Welcome everyone to Case of Philippines. Today we are going to talk about the difference between cord presentation and cord prolapse. So let's get to it. What cord presentation is when the umbilical cord lies below or alongside the presenting part while the membranes are still intact. So a very important thing to remember is that in cord presentation, the membrane is intact. As you can see in the picture, the membrane is still intact, but the cord comes before the fetal presenting part, in this case the fetal head, and the cord is not in the birth canal, it is inside the membrane. But in cord prolapse, the membrane has already ruptured and the cord is in the birth canal, either it's in the cervix, in the vagina, or protruding through the vulva, right? So cord prolapse is a medical emergency, and so intrapartumly you can diagnose cord presentation either with an ultrasound, or when you do digital vaginal examination you can feel the pulsation of the cord, right? But in cord prolapse, the cord is already in the birth canal and you can feel it during the digital vaginal examination. Or the fastest way, the earliest way of knowing occult cord prolapse is when there is sudden fetal bradycardia or recurrent variable decelerations. When you see that in UCTG, the cord prolapse should come to your mind, because when there is a cord prolapse, the cord would be between the fetal head and the maternal pelvis, which makes it compressed and it compromises fetal oxygenation, which causes sudden bradycardia and variable decelerations. So a cord presentation, like I said, is an obstetric emergency. You have to shout out for help and you have to take the woman to the OR as soon as possible. So high yield example, a cord presentation proceeds cord prolapse, and if the membrane is intact, it's cord presentation. If the membrane ruptured plus cord below the presenting part, that's prolapse. And the first sign of occult cord prolapse is often sudden fetal bradycardia or recurrent variable decelerations, like I told you. Thank you. Like, share, and subscribe for more. I'll see you in the next video.